Hi everyone, sadly I could not be in class with you today, so I will make this short video to present. And since this image of me is merely a reflection from the past, I cannot answer your questions in a timely manner. But if you have any questions regarding these topics I present, please write them on the chat and the group will address them later. So, with that being said, let's start with exhibitionism and voyeurism. In the case of exhibitionism, forcefully showing one's genitals to others, expecting a strong negative reaction, often comes from an intense need to be seen and have an impact on others, particularly over the opposite sex. According to psychoanalysis, it is no coincidence that exhibitionists want to shock others by showing publicly their genitals, while some people with the same intense need to be seen recur to other measures. By publicly exposing his genitals to strange women or girls, the exhibitionist reassures himself that he is not castrated. The reaction of shock that his actions produce helps him deal with castration anxiety and gives him a feeling of power over the opposite sex. Exhibitionist behavior usually causes the viewer to feel either uncomfortable or humiliated, and this is a way of exhibitionists to kind of make the other feel the feelings they themselves feel. In other words, this kind of behavior tends to make a psychological revenge on childhood traumatic experience. And since humiliation and profound insecurity is a core feeling in exhibitionists, Stroller noted that Freud's explanation of castration anxiety did not capture the whole underlying motives of exhibitionists. So, in contrast with Freud, he noted that the underlying motivation for such behavior is, starts quote, is best put in identity terms, for humiliation is about existence anxiety, threat to core gender identity, end quote. As I was reading the text from Gabbard of Paraphilias, I couldn't help but notice that the gender used to explain the psychodynamics of exhibitionism were mostly male. So it had like a tendency to talk through the male perspective of this paraphilia, as if only men could be diagnosed with exhibitionism. For example, there's this quote: moreover, displaying his genitals enables the man to regain some sense of worth and positive masculine identity. So I was curious to know if this gender difference or this having the men as default for this paraphilia, if it's just taking men as default because there is not such or enough data from women, or if maybe it's actually that's how it is, that men tend to have more exhibitionist tendencies. I did this quick internet search and I found a Swedish study made in 2006 which stated that in comparison to their male counterparts, fewer females are true exhibitionists. The study took 2,450 randomly selected individuals, and from those, 2.1% of women reported at least one occurrence of exhibitionism, as opposed to 4.1% of men. However, the desire to be naked in public in both genders is driven by a common motive for both sexes. It's like a turn on. So according to these findings, it does suggest that there is a difference in prevalence in gender of exhibitionism. But we do have to consider that even for self-reports, we might have a bias in our heads that states what exhibitionism is and how is it valued. For example, according to sexologist T. Murray Schmidt, what sets female exhibitionists apart from male exhibitionists is their lower chance of receiving negative attention for their behavior, which has to do with the fact that female nudity is socially more acceptable than male nudity. Therefore, women exhibitionists' behavior is less likely to be perceived as an offense or a crime, which indeed affects the amount of reports for this specific paraphilia. Now let's move on to the opposite behavior of exhibitionism, which is voyeurism. Voyeurism is the tendency to gain sexual pleasure. It can be just pleasure, but mainly sexual pleasure, while observing some other people that are naked or that are engaging in sexual activity. Although exhibitionism seems more active than voyeurism, voyeurism involves a violation of a stranger's privacy. So, according to psychoanalytic theories, voyeurism often comes from oversexualization or witnessing the parents or adults having sex. Such experiences may trigger castration anxiety, which may lead to the individual to have a fixation on the primal scene. Therefore, voyeurism behaviors can be an attempt to actively master a passively experienced trauma. It is also thought to be a displacement of the aggressive desire to be destructive to women. And Fenichel, well, he also associated an aggressive component in looking, even in people who do not engage in voyeuristic fantasies or activities. As Gabbard says, even patients who are not prone to overtly voyeuristic activities may exhibit common derivates such as curiosity and anxiety about looking. Some patients are even reluctant to glance around their therapist's office for fear that their curiosity will be construed as destructive or that they will see something forbidden. And coming back to that Swedish study made in 2006, they also noted that 3.1% respondents reported at least one incident of being sexually aroused by exposing their genitals to a stranger. And 7.7% respondents reported at least one incident of being sexually aroused by spying on others having sex. Consistent with previous research in clinical samples of men with paraphilias, respondents who reported either exhibitionist or voyeuristic behavior had substantially greater odds of reporting other atypical sexual behavior, like sadomasochist or cross-dressing behavior. And it is believed that in the same way that exhibitionism and voyeurism, masochism and sadism are also attempts to reverse the childhood traumatic experience. However, it seems that the trauma in sadism and masochism involves some sort of physical or sexual abuse. On one hand, in sadism, the person gains a sense of mastery over the trauma by inflicting on others the wounds they carry themselves. While in the case of masochism, Venichel believed that patients are choosing the physical pain over castration, or that they believe deeply they deserved such punishment. Starts quote, "In some cases, these patients defend themselves against separation anxiety by submitting to abuse. They are frequently convinced that a sadomasochistic relationship is the only available form of object relatedness. An intrusive or abusive relationship is better than no relationship." And for example, there is this case in the text about a 19-year-old girl that was asking repeatedly her therapist to hit her. So when they explored a little bit this through words, they found out that for her the physical pain was better than spiritual death. So it was for her a way to be connected to people and to reality in that sense. Contrary to exhibitionism and voyeurism, in sadism and masochism, there is no clear or significant difference between genders. And although masochism has been traditionally associated to women, there are always muted sadistic and masochistic fantasies found in everyone. It has also been observed that in many cases of patients with this strong inhibition for sexual desires can have strong sadistic fantasies that prevent them to engage in sexual activities with others. On the other hand, authors have noticed that masochistic patients have a tendency to organize their whole lives around their parents' needs. I found curious that in sadism and exhibitionism, the way to cope with the trauma was to make others feel what they themselves were feeling in a similar or almost identical way to Melanie Klein's projective identification. And since projective identification is a more primitive defense mechanism, it allows us to think of sadism and masochism involving more primary thought processes as opposed to their counterpart of voyeurism and masochism. Now let's move on to the probably most conflicted paraphilia to us all, which is pedophilia. The DSM-5 diagnostic criteria for pedophilic disorder states that the individual may have persistent sexual fantasies or desires involving sex with a prepubescent child. This is typically under the age of 13. To qualify for a pedophilic disorder, one must also be at least 18 years of age and at least 5 years older than the victim. Now, not all individuals who have sexually abused a child necessarily meet the criteria of the DSM for pedophilic disorder, nor Do all individuals with a sexual interest in children actually go on to commit child sexual abuse? In the clinical practice, many pedophiles are found to have serious personality disorders. A study made in 1999 by Raymond of incarcerated pedophiles found that 60% had a personality disorder, 20% had a narcissistic personality disorder, and 22.5% had antisocial personality disorder. Sexual activity with prepubescent children may shore up to pedophiles' fragile self-esteem. Similarly, many pedophiles with this perversion choose professions in which they can interact with children because the idealizing response of children helps them maintain their positive self-regard. In return, the pedophile often idolizes these children, and the sexual activity with them involves the unconscious fantasy of fusion with an ideal object or the restoration of a youthful, idealized self. Also, anxiety about aging and death may be warded off through sexual activity with children. It has also been observed that comorbidity with narcissistic personality disorder or psychopathic structure tend to have a similar dynamic of sadism, where the sexual conquest of the child serves them for a revenge of their own traumatic experience. Power and aggression are also prominent concerns of pedophiles whose sexual activity is limited to an incestuous relationship with their own children or stepchildren. So, as we see with pedophilia, there are a lot of challenges when it comes to treatment. One of those being our own biases towards pedophiles and our own prejudice and repulsion towards such paraphilia. Also, the difficulty in treatment is due to the extensive comorbidity with other personality disorders, and that there is serious brain impairment. And that is all from my part. Now Katie will take over to present the rest of the paraphilias.